So I had what they call a complex migraine. I had the headache, but I also had left-sided facial numbness that was concerning. Tried to over-counter things, medicines, wasn't working. Drove myself to the ER, probably wasn't the brightest thing to do. Was met by triage when I walked through the door, and they whisked me to the back, and boom, there was Dr. Greenberg, who essentially got the ball rolling.
We'll do a pretty thorough history. I'll do a very thorough physical with a neurologic exam. And then I'll work with my teams of nurses, techs, paramedics, CT, MRI, lab, whatever we need to get done so we can make sure that we give these complaints the attention they need and get the outcomes that we want. So I'm watching those images in real time. And once I realized that his CAT scan looked okay, we were actually able to facilitate an MRI and an MRA from the emergency department. And that's really unique to our neurologic emergency department here. There's really not many ERs across the country that are going to have rapid access to those studies.
With the facial numbness and the history that I knew I had, I was scared, to be honest with you, and that's why I brought myself to the ER. And you know, she assured me that she would take good care of me. And you know, if I would have waited, I would have never known, and it could have been something more serious. And thank God it wasn't.
He came in, he's concerned, I'm concerned. We work the problem through multiple steps, and in the end, it's a great outcome. Everybody's reassured, and he's doing great.
Today, I've been quote-unquote migraine-free, no headaches, no numbness, and I owe it to Dr. Greenberg.